Can you smile? Relax. Show your teeth like this. Bring your jaw forward. Now close your eyes. Okay. English is okay or Hindi?
Yes.
Both. So you can tell with Hindi only, English only. You are having major problems with your jaw. So what is happening is, not only is the problem with the lower jaw, which is obvious, but you're having little problem with the upper jaw. I'll tell you what is the problem with the upper jaw. The upper jaw has not grown enough vertically and horizontally. So when I look at your face, the nose is the only thing that is visible, first. Secondly, the distance between the tip of the nose and the lip is very less. Your lip is only this much. So there's an imbalance. Thirdly, when you smile, your teeth are not visible nicely. So these are three main concerns on your middle third of the face. Upper third is very nice, we don't have to touch. Middle third doesn't look like a problem, but there are three problems I'm telling you. Lower third of the face is obvious. It's very short chin, very retruded chin, and even this angle is all 90 degrees, it should be about 110 degrees. So that's the lower third of the face. So in order to correct all of this, so you don't need a rhinoplasty. I have to do what is called as a bimaxillary surgery with a genoplasty. So I will be rotating the upper jaw forwards and downwards. When I rotate it downwards, this gap increases. Teeth show comes, nose becomes small. All the three objectives will be met in one go. Lower jaw, because this is moved forward and rotated, this has been rotated the other direction and brought out, and genoplasty. So angular osteoplasty, that means a little will be done here, a little will be done here, a little will be done here, here and here. So what are the changes you expect? Nose, lips, smiling, chin, cheeks, and all. This is like a face makeover surgery. That's what you need. There is no point that if you do genoplasty also, there will be improvement. But what I am suggesting will change your whole facial structure and make it much more harmonious. And you should not do a rhinoplasty and make the nose small, because the problem lies somewhere else. So when you do these things, you can get all the desired changes.
And I'm also consulting for the face symmetry.
That will be done the same way. That little asymmetry, when we are planning all this is a planned surgery. So we'll have to take your models, we'll plan the cuts, millimeters. Now I'm just telling you with the rough thing on the scanner I've seen, but they're going to take measurements and all. It will take time for us. If you're okay for surgery, then we will start the process. That might take 24 hours. So which means we cannot do the surgery till tomorrow afternoon or something, or at the same time. If you're not okay, or you're okay later on, we will not go ahead with the planning of the scans and the models and the impressions and the bites now. We'll keep it till such a time you're ready for that. Because that is a lot of work that we'll do once you say okay. If you have any doubts, you can ask me. Ma'am, you also have any doubts, you can ask me.
Major consequences of
Nothing. You're going to have
surgery.
Well, I wouldn't call it as a drawback, but these are major surgeries. These are very fine surgery. What will happen is you will need to do about 7 days to 10 days with us, 3 weeks of recovery, 2 weeks of some diet, and 1 month before you start doing all your normal activities, or 1.5 months before you can go for gymming or swimming. This is the overall picture. Lifelong, no side effect will be there. Only thing, there will be plates and screws in your face. We'll be putting lots of plates and lots of screws. And these are good German titanium we use. So only 1 in 100 patients have some problems with them. 1% of the patients can have some issues with these plates and screws, especially when we're putting plenty. Like in your case, you might put 8 plates and 45 screws or 42 screws. So that's a big number. You need that. So that could be an issue. And like I said, a very small percentage of patients have. If it comes for you, or if it happens, we can easily remove those plates and screws in 1 day without changing your facial form.
So it will be removed or
no, it will not be removed.
Option.
Only if it causes a problem, which I told you is 1 in 100 patients. So it's very rare again. You will remove it. Otherwise, nothing to do for you. Face surgery, you go back, colors. You don't come and see it. You might need braces or aligners or Invisalign or some kind of treatment for your teeth. That we tell you once we plan the surgical modality.
And as you know, that number of nerves here.
That how you're going. All the nerves will be fine, your sensations will be fine, teeth will be fine, nothing will go wrong. We doing this for more than 20 years and we do like averaging 30-40 a month. So don't worry about any of these things. Nothing that will happen. That is an assurance.
What is the cost?
That I will message, I will write the cost plan now because see, based on the plan the costing will be. And then once I write, they'll tell you the costing, then you can plan. When would you want us to do this procedure?
When it will be possible.
So, if you're okay today, then what we will do is we'll run a quick blood test. We'll see the anesthesiologist. We'll make sure you're fit for surgery. Once you're fit for surgery, we will start our process. One of our assistant doctors, he will work on the scan. Another one will take the impression. We'll make the models. We'll do the mock surgery. So if you say, okay, in the next half an hour, we can plan surgery tomorrow around the same time, earliest.
And what will be the time span of surgery? Like
5 hours, 4-5 hours. It's not going to be done very quickly. It takes some time. But there's nothing you have to be worried about. But it will be a long surgery comparatively. If you're doing everything that I mentioned, not less than 4 hours.
And will it be all okay after?
Immediately you'll be fine. After
So I
surgery,
mean
you'll
to
be...
say that my face structure and
Yeah, sure. There'll be huge improvement. So I've clearly told you the issues with your face, what are all the problems that you're having, and we can address all of that with this one video. Okay, so I've written down, you first meet with my staff, then you give the okay, because this is not an emergency surgery. You can do it after 6 months also. You can do it after a year also. That is your decision. This is not something that needs to be done like now, because this is a planned surgery. You've come planned also for some surgeries, like rhinoplasty and all, but you don't need that. I told you why. So you talk to my staff on this now. And
so
then
my face length will be
will increase a little
increase a
bit,
little.
but this angle will increase, will become better. You see your angle is not correct, and asymmetry is there, that also we will correct at the same time. Chin is going towards the left side. If you see, that will be in the center. Chin height is slightly more, lip will be exposure more, smile teeth will be there, nose, and all the things I told you will change.
And this symmetry will be there.
Yes. Yes, sir.